Oh, Professor Maron. And you lead the United States HCM Center of Excellence and advocate CAD referral. How does your HCM COE operate, and how do you facilitate appropriate patient referrals?
Yeah, so I think the answer is that we have a multidisciplinary center where patients will be referred from outside cardiologists for consultation, and we have 3 cardiologists that will see the patients in the clinic. But we also have a multidisciplinary group of cardiologists that are involved with certain levels of expertise that can help provide care. For example, we've got electrophysiologists that are experts in providing ablation and devices in patients with HCM. We have a surgeon who can perform myectomy at a high level. We've got a catheter-based procedure. So we've put together and assembled a whole group of team members with expertise in HCM that then can provide patients that come to see us the highest level of care that we can provide through that model. And I think the other point I'll make is that, what makes a center of excellence also excellent is that you have the opportunity in a center of excellence to spend time with patients, to educate them on their disease, to essentially give them the information that they really need to become empowered to make the best decisions for them about treatments. Okay? And that's something that I think centers of excellence can do very well, and much more difficult to do when you're not at a center of excellence, where you may not have the time or expertise to be able to have that kind of discussion with patients. So it's both treatments, but also education that forms the cornerstone of the centers of excellence. And then third, I'll just make one other point, because I think it's really relevant to, I think, this development of centers of excellence in China, is that also in our experience, when patients come to see us, they will then go back to where they may live, which could be quite a distance from our center. But we have relationships with the local cardiologists that can then help them with us to communicate, to extend care to those patients so that they don't always have to come back to the center, but still get our input that way. So there's a relationship that we develop with the local cardiologist that also becomes really important.
东方问道。